Hi, have you ever heard of artificial intelligence? I feel like you probably have, and you're going to hear more about it today. I'm a public health professional, specifically a local public health department's lead epidemiologist for their epidemiology program. We've been talking a lot about and testing out using AI like OpenAI's ChatGPT in our work. The effect for me has been noticeable. Areas of strength have been improved, and areas of weakness I'm learning more about. It hasn't all been great, though, as I know that some people will rely on AI in a way that might not lead to learning and potentially mistakes in the work that they're doing. I'm not immune to that, nor are my peers. So I wanted to do a study to help understand this dynamic of benefits and barriers to adopting AI into local public health practice. This mixed methods course to public health allows me to do that. So let's get started. Artificial intelligence, or AI, and local public health practice, a mixed method study. First, AI and public health. That's pretty vague, but it is the general topic of this research proposal. More specifically, I'll be examining how machine learning and other applications of AI type programming is being used by local public health professionals and how applications can be incorporated to maximize efficiency and effectiveness of public health practice. So why am I doing this research? It's a fair question. There are significant gaps in our understanding of the relationship between AI and all fields, including public health. We need to better understand these gaps and the context that AI adoption may occur in. My research proposal will focus on clarifying the barriers and the benefits, or the pros and the cons, to incorporating this technology into our work. Barriers may include administrative challenges, cultural concerns, technical challenges, political hesitancy, and so much more. I would urge you to think about these barriers if you're passionate about incorporating AI. Still, benefits are important too. Limitations caused by reduced staff and turnover could be addressed using AI. Programming and technical knowledge gaps can be bridged using this tool. Administrative tasks like drafting a budget outline or an email response for other examples. I'd also urge you to think about these benefits if you're concerned about AI. Since this is a research proposal for a mixed method study, and to make sure it's clear, I listed out the research questions here on this slide. The first question I have is quantitative. What are the levels of adoption into public health practice, or how many people are adopting AI tech? And what are the primary determinants of adoption in a quantifiable cross-sectional assessment? The second question I have is more qualitative. What are the most common themes associated with adoption or rejection of AI into public health? I would look at this by profession, organizational role, and a range of other contextual factors related to their role in the organization and their responsibilities. Finally, the mixed methods research question I aim to answer is, what is the relationship between levels of AI adoption and the themes associated with AI adoption? These three questions will be core to achieving the goals of my research project. So how am I going to do this research? This mixed methods study design would use the explanatory approach. This includes a quantitative component that leads into the qualitative component, and where we interpret the qualitative and quantitative results together at the end. For the quantitative component, we'll use a cross-sectional survey of local health department staff and management in Nebraska to describe their use of AI applications, proficiency, comfort levels, and training needs by different types and levels of public health practitioner. We'll use descriptive statistics and inferential statistics depending on the variable type, but ultimately, we'll likely apply a regression model to see what the greatest predictors are of AI adoption into the quantitative model. For the qualitative component, we'll use semi-structured interviews exploring experiences, perceptions of benefit and barriers, suspected training needs, and future outlooks on the adoption of AI. Responses will be coded by an array of analysts from participating departments and the researchers to create a coding structure. Agreement analysis to identify discordance will be conducted. Finally, these coded responses will be grouped together to describe the themes that are most prevalent. In the next slide, you'll see a diagram that shows this all. So here's the diagram. I already described the quant and qual components, but let me clarify some connections. First, the connect part, where I'll analyze the results from the survey to design the interviews. The questions for the interviews will be designed to help answer the research questions, so I'll be able to tie the qualitative section back to those results. Second, after the qual section, I'll merge and interpret the results and explain the connections and draw some inferences. So the thematic analysis from the qual part will be tied back to the quant part to help me answer the research question that is ultimately asked and simply, why is adoption different and what can be done to improve AI adoption if it's appropriate? I've touched on this a bit, but I wanted to start to wrap things up with this visual showing what I hope to better understand by the end of the study. Understanding the barriers will be critical if we aim to address concerns with AI. Understanding benefits is also critical to incentivize and encourage the use of AI. Specifically, I wanted to look at barriers and benefits by the type of professional, their administrative role, and the political context, which all vary widely and are very important in people's work. All of this should lead to further research and, who knows, maybe serve as a reference for those designing their studies. Finally, I really want this to be practically useful for public health to be able to inform teaching and training opportunities. So what now? Once the study is complete, I plan to release the reports publicly, maybe as a publication, and provide reports tailored to the audiences, whether it's experts in training or different areas in public health. I find often that a single document for multiple audiences is less effective for all the audiences because it's too much for some individuals. That's true for me, at least. I also want to design further research expanding on the results and addressing the critiques of this particular study. I wouldn't mind being involved in developing a training plan to pilot with local health departments in Nebraska. Finally, I would want to monitor AI adoption and evaluate how this training affects that. So thank you for listening. I hope that this presentation was interesting and maybe spurred your interest in adopting AI, or at least understanding the details of AI adoption. If you have any questions or would like to talk about this proposal, please feel free to reach out to me at togeorge@unmc.edu. And again,